Welcome to episode 233 of the Healthy Habit Podcast. I'm your host, Dr. Dayan of Healthy Habit Medical Center, and we're joined here with the legend himself, quickly becoming a Healthy Habit Podcast legend here. Dr. Virender Sodhi, representing Ayush Herbs and Ayurveda, is back with us here today. Naturopathic doctor, medical doctor as well, Ayurvedic medicine, is an internationally respected Ayurvedic and naturopathic physician who's credited with evolving the understanding of Ayurvedic herbal medicine in the West. And Dr. Sodhi, his experience with Ayurvedic and naturopathic medicines has resulted in extensive lecturing worldwide on these subjects, culminating into his latest book titled Free Medicine, Your Body, a Natural Pharmacy, which I've mentioned in previous intros here with Dr. Sodhi on the podcast. So I highly suggest you guys go check that out and start creating your little library of his books to know exactly his way of thinking, his approach to medicine, and how to keep the world healthy. Dr. Sodhi, welcome back to the podcast.
Thank you, my friend. It's always a pleasure to be on the radio show.
One of the last episodes we had you on was 195. And there we talked about heart disease, high blood pressure, statins, cholesterol, much more. Importance of CoQ10. We highlighted curcumin, Ayush Herbs products. You can go to ayush.com, folks, to follow along with everything we'll be discussing here today. We're going to be covering bones. Dr. Sodhi is going to educate us on his approach to bone health. Where do you want to start us off with, my friend?
So I think let's first look at how aggressive this issue is. It's a silent killer, and we are not paying much attention to it. Around almost 50 million Americans suffer with it. 10 million has osteoporosis, 40 million has like a osteopenia, and they even don't know about it because it's under the carpet. Nobody's looking at it.
Yeah.
So I think doing simple tests like bone density will help us to find out. You can see if you have osteopenia or osteoporosis. And especially females are a lot more prone to osteopenia and osteoporosis as compared to male. Almost unfair. Around 50% females will have a tendency to have osteopenia and osteoporosis, whereas 25% men. So we can see there is a huge discrepancy in the osteopenia and osteoporosis in male versus female. So all of us, including me and you, need to be careful because 25 is a pretty huge too, but female almost double that number there. So I think we needed to be everybody above age 50 needs to be evaluated if they are losing any bone mass. And then the tips which I'm going to talk today, that will be very helpful. It's a process. It's not like popping in a pill. It is a process. You have to do right kind of thing, right kind of food, and making a lifestyle which is bone healthy lifestyle.
Yeah.
And we have a lifestyle which is not bone. Actually, we have a lifestyle which is standard American diet, which is also I jokingly call it a sad diet, which is not in favor of any health oriented things, but osteoporosis, osteopenia is also one of them.
Yeah, you're absolutely right. It's much more common in women, especially going through the perimenopausal, menopausal years, right? With the estrogen and progesterone, when they
dropping
the
down,
bones get brittle.
Exactly. There's an interesting caveat to it. If you are thin bone, small frame girl, low weight girl, you have more chances of getting osteoporosis. As you turn into menopause, the body start making more estrogen from the adrenal glands and the secondary from the fat cell. So I tell my patient that if you are menopausal, postmenopausal, slight roundity is not bad because it has one thing is you need some fat cells to make extra
100%.
estrogen. And but also it has another benefit. Like when you fall down and if you don't have any cushion of fat, all the impact of the fall is going
On the
to
bone.
on the bone. So that is, so sometimes people don't, especially the girls don't like it when I say that, but it is in our favor. I'm not saying obesity, I'm talking about, some extra amount of fat is beneficial for the a male and female both, in that, and especially andropause and menopausal females.
Maybe like 24 BMI, 23 and above instead of right there at 18, right at the bottom of the BMI, right?
Exactly.
So very important. It's often considered a silent conditions. What are
Exactly.
some early warning signs some people need to look out for their bone health? Not everyone has had a bone scan. What are some things to look out for?
So one thing which is very obvious, and you will see it, like I have my classmates, we have around 100 students in my medical school, and whenever we go and meet these people, they look shorter than me,
Hmm.
and they were taller than me, and says, "Oh my God, this guy was used to be taller than me." So basically, we are just shrinking. So that's one of the very obvious sign which we can all watch. And so I think I keeping my stature because I exercise, I eat healthy, and I do a lot of yoga. So I do pulling exercises, and that helps you to keep your calcium in the bones rather than into your circulation, where it can be a good and bad depending upon what it's doing to you. If it's going to your heart, it's going to cause heart attack to you. If it's standing in the muscle, it's going to be aches and pains. So one of the symptom, very chronic symptom, is body aches and pains and bone ache. People say, "Oh my God, my bones are hurting." So that is a very
Hmm.
obvious sign that something is not good. It can be also muscle stiffness because the microfractures, very minute microfractures. And I've seen people with the coming to me with a severe low back and back pain. When we send them to get the X-ray done, and they will have microfractures in them. And there is another disease which is not a good kind called multiple myeloma, and that also has a punch holes on the whole spine. So a lot of times I found out by sending people to do the X-ray for thinking they have osteoporotic fracture, but it turns out to be multiple
Oh
myeloma,
wow.
more dangerous kind of disease. So
Yeah.
I have diagnosed many patients in my lifetime over just sending them to get the X-ray done. So watch for that. The simple, very easy test is doing bone density. It's not very difficult. And then you can see that what score you have. This is called T score. And if you normal, you're not losing bone, you should be within the range. But as we get older, all of us, including me and you, everybody, we're going to lose some bone mass there. And because of many reasons, one of the hormones, because testosterone, estrogen, and progesterone helps the manufacturing of the bone. So there is the osteoclastic and osteoblastic activity. And so you make and break. It is happening every second, by the way. It's nothing, not a second goes that the bone is not manufactured or destroyed. So the body is very intelligent. What
Right.
it does, it manufactures a new bone, but then it takes the old bone away from it so that it does not pile up. And a lot of drugs which we have in the available today, they actually stop the breakdown of the old bone, and that's why people
Right.
end up having those jaw, issues, and the because you're collecting the old bone, and that
Wow.
is more. It bone looks bigger, but it's not a stronger bone either.
That's
So that is,
unbelievable.
I think, people need to be a little aware of it. I think anybody wants to put anything in your body, natural, unnatural, or synthetic, you should go Google it on the line and see if this is really what are the side effects of it. What I'm long term, not look for short term, because this medicine you're not going to take for 1 or 2 days. You're going to be
Right.
taking for a long, long time.
Unbelievable. That's a fantastic breakdown, Dr. Sodhi. Yes, it's a living, breathing tissue, our bones. People don't think of it, that they're actually
Exactly.
alive and moving and shaping,
Exactly.
reshaping every day. The problems when the osteoclastic activity is outnumbering or when the breakdown of the bones happening faster than the growth of the new bone, right?
Exactly. Yeah, and there is a very fantastic studies where they did the isotope studies, and they see, oh my God, every second the bone is changing. It's nothing, but the bone you have, even your teeth, it doesn't look like they're changing, but they're changing
Yeah.
every second. So that we can see the healing mechanism right there in the
Yeah.
body. So you have the potential to send the right kind of messaging to your teeth, to your bone, to your muscles, to your heart, to the every tissue in your body, because it's constantly renewing.
100%. You mentioned a few moments ago about calcium. sometimes you want a certain amount in the bloodstream, right? It literally
Yeah,
comes up in the comprehensive metabolic panel.
that's
There's
right.
calcium there. You need some. But the
Yeah.
problem is if there's not enough or if there's too much. But what about calcium supplements in general? Is more better when it comes to calcium? I think people maybe take too much as supplement, but I want to hear your thoughts in general. Do you think more
Sure.
is better when it comes to calcium? If someone has weaker bones, just start taking calcium. How do you
Yeah.
approach calcium?
So as you know, the serum calcium is not correlated to osteoporosis or osteopenia. It's
Right.
not good. Whenever you have higher or low, it's actually a kind of, oh my God, something
Right.
is wrong.
Something's
It-
really off if calcium's off.
Really, really, yeah.
Yeah, yeah, exactly.
And so there is a hormone called parathyroid hormone that can also pull your calcium out of the bones and causes the problem. And if you have a low, that's also a problem. So I think serum calcium is not the good indicator for us
Right.
for checking out the calcium in your body. So yes, there are lots of good calcium supplements available, but I think as a naturopathic physician, as a nutrition, we have done wrong too, because the RDA is around 1,200 milligrams to 2,000 milligrams, depending upon your age and factors and the disease you have. So we were putting everybody on that amount of calcium. And when I was studying at Bastyr University, we were told the calcium citrate is more bioavailable than calcium carbonate. I think yes, there is a more absorption of calcium citrate naturally. But the problem was that we were also eating vegetables, we were also drinking milk, we were also taking yogurt, we were also taking almonds, we were also,
Right.
so we were overdosing all the calcium, and that overdose calcium can be problem. And what they found out, that people who were taking more calcium, they have more calcium deposits in their heart, and that is
Wow.
a heart disease. So we cannot do that, I think. So basically, you should have a comprehensive. Go to a physician who knows what he's doing. So anybody above age 50, I tell them to get a calcium scoring done. So look at the heart. You have any calcium deposit? Then we change strategy. If they don't have it, they have a zero score. That is the best zero you got. You want to get a zero. Zero in the exam is not good, but the zero on a calcium score is the
Yeah,
best
yeah.
thing, best score you got there. And then, look at the comprehensive, look at the hormones, look at your testosterone level, look at your estrogen level, progesterone level. And if the female, look at their in menopausal, you can check your LH and FSH hormone and see if they are in menopause or going to be in menopause, which you can predict by looking at those numbers, and then make a strategy from there. So calcium is a good, depending upon what's going on with you, and it can be bad if you have cancer. If you have a cancer and calcium, they don't go very well together.
Yeah.
So you need to watch that. So I think too much of anything is not good, as you know, but there is a balance, and Mother Nature has provided us. I know what I take a little chuckle out of it, that says, okay, where the animals are getting calcium, which calcium supplement they're taking, what they're eating is greens. They're eating, they're getting from the bones, depending upon what kind of animals they have. If it is a herbivorous, then certainly they're getting from the
Yeah.
vegetables or
Exactly.
greens they're eating. And if they are the eating the animals, or the bugs, they're getting from that one. So they had that amazing perfect balance, and they're not crumbling like the humans are crumbling these days. You don't see osteoporotic animals or birds, because they can't fly. If his bird is osteoporotic, he cannot fly, because there is so much pressure you have to build up for flying. So I think as a humans, we have done a lot of things wrong, and we need to go and learn the Mother Nature model and understand how the Mother Nature works and follow. That's basically what Ayurvedic medicine is. They learn from the Mother Nature, what Mother Nature does to you in a natural form. And when you follow that, we're still gonna go for recycling. We're still gonna die. But it's not with the diseases. With the quality of life, you will die until you're conscious, you're present, you're walking, you're talking, you're cognitive. That's the way to do.
Yeah, and I think you would agree with this. Most Americans, they're taking in plenty of calcium. Tons of cheese consumption and milk
That's right.
and ice cream. Like there's enough calcium in there. So
Yes,
there must be some kind of other problem. Probably maybe taking in too much dietary calcium. Would
that's right.
you agree? And then it's the body doesn't know how to clear it out fast enough. It starts getting deposited inside the arteries, inside the
Exactly.
bones and the heart. Is that true?
That's true. Very true. But the interesting thing is that also, if you look at the American population, majority of them are taking proton pump inhibitors, PPI, like imiprazole,
Oh yeah.
Prilosec, all those kind of drugs, and that antacid. So we need acid in the stomach to absorb more calcium. If you
Yeah.
don't have a good acid, you're not going to absorbing it. And there are a lot of drugs, especially steroids, that blocks the metabolism of your bones. And a lot of even what see, this is my observation. I yet have to find. I think there will be some paper available too. Even people use the nasal steroids
Mm.
inhaler, which is, oh my God, no, no, no problem. I've seen those people osteoporotic more than the other normal people.
Interesting.
So I think even a small dose of steroid
Wow.
have impact. And I start noticing it maybe around, I think 45 years ago, the people, diabetic people who used to come and they have allergies. So the allergists used to tell them at that time there was no nasal sprays like we have nowadays. There was the ointments available of betamethasone or hydrocortisone. So there's okay, put on a cotton swab, put in your nose.
Wow.
And people who will swab their nose with it, their blood sugar will be more higher than the other people. So I said, whoa, small dose, like a very, very minuscule amount of it, make the blood sugar go crazy. So just think about what it
Yeah.
the effects of on the whole metabolism of the body. So a
Um.
lot of times which we think a benign is may not be benign. It may be causing some really very bad side effects to you. So I
Yeah.
think another thing is the gut metabolism. If you can eat all the calcium, if your gut biome is not very healthy, you're not making a good thing. And when you eat vegetables, you're getting a vitamin K1, phytoquinone. And if you have a good bacteria, that convert it into vitamin K2 in your gut. And now, if you don't have that good bacteria, it's not converging into K2. And K2 is the one which takes the calcium out of your bone, out of your muscles, out of your arteries, and put them into the bones where it needs to be. So I
Uh-huh.
think it's a complex issue. It's if you're not acidic enough in your tummy, and a lot of Americans has that reflux and
Right.
this acidity, and they are popping in all those stuff to suppress it. So that can be one. Then a lot of population is on medications,
Oh yeah.
and the average American above age 70 is on around 13th medication, and out of
Wow.
them, five are for the side effects of the other medication they're taking, like you're taking diuretic. Now you're paying out potassium, so they have to add potassium on top of it.
There you go.
So, there is if you're taking for the men, for example, for prostate, the alpha blockers, like the Flomax kind of medication. Now you are also causing constipation with it. So there is
Yeah.
there is a loop of things which we are.
Exactly.
Our system is complex, and we are making it more complex by adding these medications, not looking at the full picture of it.
Right, and all these things can affect calcium metabolism
Better.
because it needs these cofactors. So if you're
Exactly.
depleting or messing with your electrolyte potassium balance, plus you have all this inflammation going on, calcium can't work properly. So, what are the most important nutrients or herbs that can help the body actually use calcium properly from Ayurvedic perspective or naturopathic doctor perspective?
So, one of the most important is vitamin D, as we all know. Vitamin D helps the absorption of calcium and put them into the bones. We already talked about vitamin K and how the K1 converts into K2, and that helps to. And actually, I have patients with the higher calcium scoring. When we put them on K2 vitamin and change their diet, it start to pull out from that. The
Uh-huh.
arteries start opening up. So very simple, very easy. And a lot of time, it's a scare. People go and get the stenting, which has shown no benefit over for the overall survival and even cutting down the heart attack. So you can do it at home, but again, you have to have a belief system in you and your doctor you're working with. Then also magnesium is very important. If you have a low magnesium, you have problem with it. Vitamin K2, digestive enzymes. If you're not having enough digestive enzyme in your gut, and again, it starts with chewing your food properly, looking at your food. Let you salivate on your food. When you salivate in your food, you are actually making all those enzymes, making those very important things for the body to digest the food.
Right.
All those simple technique: calm down, relax, breathe. If you're eating in a hurry, you're creating a problem because you're rushing through it. When you're not chewing your food properly, now you're not making the all the enzymes, all the cofactors spreading on it properly and not properly absorbed and ending up in indigestion and malabsorption.
Uh-huh. And do you have a specific bone formula available through Ayush or Ayurveda?
Yes, we call it a calcium, and this is the calcium from the algae, which is very bioavailable and is very wonderful. There's a wonderful studies available on it, and but that is, that's simple and good. But the best thing is we have a herb called Cissus quadrangularis. It is a cactus. The
Uh-huh.
cactus in Arizona,
Oh
which
yeah.
is famous for the. So it's a specific kind of cactus, and quadrangularis means four angle. So you might have seen it. It has
Uh-huh.
a four angles, and it's like almost like a vine.
Okay.
It climbs on, and very wonderful herb. And in Ayurvedic medicine, we call it a had joda. Had mean bone. Joda mean to manufacture.
Is
It
this through
manufactures
Ayush?
the bone.
Ayush.
Yes,
And how
yes.
you spell this one?
The cissus quadrangularis or had joda.
Ayush, the Harjinda.
The Hadjoda is we
Harjinda.
have in our calcium we have that
Got it.
added into it. And also the second preparation we have is Allegfem because for the menopausal and postmenopausal female. So these herbs
Okay.
are present in that one. So there is amazing data available on it on almost 1100 patients. When they were given this one, they actually had a more wonderful results with the bone manufacturing and the osteoporosis, osteopenia got better. I use it daily. I'm 68. I don't want to have I give it to my wife daily, just one pill a day, because you don't want to overdo on calcium. So remember that. So it has
Right.
around 660 milligrams of calcium, this calcium, and it's called Ayush calcium, by the way, simple.
And I'm
And
doing
it's,
a screen
yeah,
share here real quick as
exactly.
Dr. Sodhi's breaking down this product.
Yeah,
This is if you're following along on YouTube, folks, you can go to ayush.com,
yes.
and even in their search bar there, you just type in calcium, and we have the calcium cofactors, bone health and mineralization support. And again, algae based. So what is that sourcing coming from of the algae? Is that from like tell us more about the algae based.
So the algae is a kind of available, more bioavailable calcium in it,
Yeah.
and it is also recyclable. It can be harvested and it doesn't destroy. And plus, the amount we're using is so small.
Uh-huh.
So unlike a lot of other things, which people are kind of destroying the environment, and it can be grown or in the contained environment. So this is really very diverse and things which is easily available and not making any big changes into the environment.
Yeah. And of course, boron, strontium, extremely
Yes,
important for bone health.
whole health, yeah. So
Um,
it's and plus has a the vitamin D3 into, but small
uh-huh.
amount. You maybe need more, but this is just too big because everybody almost who's taking supplements taking vitamin D. So we didn't want to put too much because again, too much is also a problem as too little is a problem.
And there we go. This is important that you were mentioning the Cissus quadrangularis.
That's right.
What an interesting word, huh?
Yeah,
Quadrangularis, Cissus. So this is the one Dr. Sodhi was just referencing about
yeah,
5 minutes ago or so. That can be found right here in this calcium product, calcium plus cofactors through Ayush Herbs. Just
yeah.
ask one of our staff here at Healthy Habit for this. It's either going to be in our bone section or we have a whole Ayush Herbs section. If we're out, we'll special order this product for you guys, and we do ship nationwide here at Healthy Habit. And this is 2 tablets a day, it looks like, Dr. Sodhi.
Yeah, that's right.
And of course, we're not giving any medical advice, even though both of us are practicing physicians. This is just for information purposes only, education, to show you this company exists at all, even Ayush.com. Now you know about them and Dr. Sodhi. And this might be a tool you want to use in your bone strengthening journey. And again, he mentioned to get a bone scan, get a T score. That's important to know where you're starting, not just rely on the calcium number in a CMP, right, Dr. Sodhi?
That's why, yeah, it's not reliable at all.
Maybe
You
check
know,
PTH hormone, maybe check PTH serum. That might help,
exactly.
right?
Yeah, especially if your calcium is high, then PTS should
Right,
be
right.
ordered at least.
Yeah,
Yeah. So
good.
one other another thing about the this formula and herb is like I give this to a lot of people who has like multiple myeloma. They're losing the bone
Okay.
when the cancer is spread to the bones, and so they need something to help it. So I give it 1 or 2 tablets a day. And what I've seen is it doesn't cure it. By the way, I'm not saying this cure it, but
Yeah.
they are getting better result. The bone pain, bone ache is less. So there is something to which beyond my understanding right now. I don't have a way, but I think what it does, it really helps the bone manufacturing in such a way that it supports the healthy way of it doing it. This
Uh-huh.
is the difference between a synthetic and a herbal formula. Is the herbs actually have a switch on and switch off mechanism, whereas synthetic does not have the switch on and switch off mechanism. So
Right.
it can understand body's language and can talk to the body. So that's what I'm a great fan of herbs, and it is amazing what the herbs can do to you.
I love it. We could talk another 2 hours just about this because you're blending both the Ayurvedic and the naturopathic perspective in this, which
Yeah.
is extremely unique. One of, if not the first official naturopathic Ayurvedic physician in America here. So you've been doing some incredible work. I always appreciate your time, Dr. Sodhi. And one other thing I would add is to do weightlifting as well. You mentioned you do exercise and yoga, but
Yeah,
weightlifting, how important is that? We'll finish on this note for
exactly.
sake of time, but how important is lifting weights for strengthening the bones?
Very, very important. So when you're doing the weight training, you're pushing the calcium into the bones.
Mm,
And so another thing which when you people has body aches and pain, their inflammation markers are up. The ESR can be up, the C-reactive protein. When you have more inflammation, you're losing more bone. When you exercise, actually C-reactive protein falls. And when you get angry, frustrated, easy, you also C-reactive protein goes up. So calm down. The world is for living and it's for love. It's not for
yeah.
spreading hate or killing each other. It's just for love. We should be loving everybody. My favorite saying is, no bug is your enemy. No, the animal is my enemy. No weed is my enemy. Everything, we are part and parcel of it. So let's start living in harmony with each other, and we create a perfect health.
Absolutely. Absolutely. And again, folks, Free Medicine, Your Body, a Natural Pharmacy. Go grab Dr. Sodhi's latest book. Just Google that. Free Medicine, Your Body, a Natural Pharmacy. Ayush.com is a good starting point as well. Dr. Sodhi, always appreciate your time.
Thank you very much. Thank you for having me.